Hi, Mr. Collum. I'm Karen, your CNA for the day, and I'm going to go ahead and get my hands washed. Turn the water on. Wet your hands and wrists thoroughly. Apply a generous amount of soap. The time starts when you begin the lathering process. Make sure that you lather all surfaces of the hands, fingers, and wrists. Ensure that you keep your fingertips down during the process. We are permitted to have this clock in the lab during this skill, so you can ensure that you've done 20 seconds. The automatic failure is to not lather for 20 seconds while keeping fingertips down. Once you feel confident that you've completed the time frame, then you will need to clean your nails into the palm of each hand. This is not included as part of your 20 seconds. Then you will rinse your hands and wrists thoroughly. Get paper towels, as many as you feel necessary, to dry your hands and wrists thoroughly. Once you feel your hands are dry, you may step to the blue trash can to throw the paper towel away. Then acquire another paper towel and use it to turn the water off. Then throw that towel away. During this process, you want to ensure that you don't touch the inside of the sink. And again, as a reminder, the two automatic failures for this skill are not lathering for at least 20 seconds with fingertips down and not rinsing with fingertips down. That completes hand washing. Hi, good afternoon, Mr. Collum. I'm Karen, I'm your CNA, and I'm here to put on your elastic stockings. Before we get started, let me close the door for your privacy and get my hands washed. I'm going to go ahead and pick up the stocking from the table. Once I have the stocking, I want to unfold it, and I want to turn it inside out about 2/3 of the length of the stocking. The easiest way is to reach in, pinch the heel marker, turn it inside out, but stop just before the heel marker is visible. So in other words, your stocking should be situated so that the heel marker is about 1 to 2 inches from the fold of your stocking. Then it's best to work from the end of the bed. Go ahead and take the heel marker facing the mattress, stretch it. Okay, we're going to do one movement over your foot. Okay. Then we're going to take this and go up the leg. Try to move gently without tugging or pulling during the process. As you're getting it in position, you want to ensure that the heel marker is in place. If it's not, you'll need to adjust the stocking so that it's positioned correctly. Then finish taking the stocking up the leg. Make sure once it's in position, there are no wrinkles, bends, folds of the stocking. Again, ensure that the heel marker is in the correct position. Once you're satisfied that the stocking is smooth and in the correct position, offer the client their call light. Here you go, and wash my hands. The automatic failure on elastic stockings is if the stocking does not have the heel marker in place or if the stocking has any bends or twists in it. That completes application of elastic stocking. Good afternoon, Mr. Collum. My name is Karen. I'm your CNA for the day, and we're here to take you for a walk. Before we get started, I'm going to close the door for your privacy and wash my hands. Anytime you get a client out of the bed, you always want to make sure the bed is locked and in the lowest position. The bed is locked and is in the lowest position. Then what I want to do is we're going to sit up, Corey, but I need to assist you to that sitting position. Go ahead and bring your legs around, come out to the edge of the bed, and make sure those feet are flat on the floor. Now, while I'm getting the transfer belt, which will be located on the table the day of exam, I'll ask the candidate to go ahead and put your shoes on. Please go ahead and put your shoes on. Try to get an idea of how large the waist is and adjust your belt accordingly. All right, go ahead and lift your arms up for me. When you put the belt on, you want to ensure that it's snug enough that all that can fit is your fingers. Now what I'm going to do is I'm going to secure the belt with upward grasp of both hands. Mr. Collin, on the count of 3, we're going to stand, and then we'll stand straight up. While facing the client, stand on 3. 1, 2, 3. You'll then want to position yourself to one side and slightly behind the candidate to walk a distance of 10 feet. Okay, you go ahead and go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, we can return to the bed. Again, be sure that you are holding the gait belt the entire time with upward grasp. Okay, I'll go ahead and get you to sit back down. I'm going to go ahead and remove the transfer belt. Here's your call light. If you need anything, let me know. And wash my hands. On this skill, the automatic failure is not assisting the client to a sitting position, not ensuring that their feet are flat on the floor, and not ensuring that they have shoes on before you begin the ambulation. That completes ambulating with a transfer belt. Hi, good afternoon, Mr. Collin. I'm Karen. I'm the CNA for today, and I understand you need to use the bedpan. Before we get started, I'm going to close the door for privacy and get my hands washed. I'm going to go ahead and get a pair of gloves, which will be on this table the day of the exam. Once you have put your gloves on, the first thing you'll want to do is lower the head of the bed. To lower the head of the bed, you will use the left lower button. Once your resident is flat in the bed, you'll obtain the bedpan from the bedside table. Make sure as you pick it up that this divot or crack in the pan will be facing the resident's crack. While using discretion to not overexpose the resident, ask them to lift their hips and position the bedpan in the correct fashion. Your gloves are now dirty, so let's remove the gloves in the correct fashion. Grab the palm of one hand, wad it up under this glove, turn it inside out, and step to the trash can. Again, remember when gloves come off, we always say wash hands. Return to the bedside and elevate the head of the bed. The left upper button will elevate the head of the bed. You'll bring it up to a more natural position of sitting. Once you get it up 45 or more degree angle, you then will retrieve the toilet paper and the hand wipes from the bedside table. You must tell them what to do with it. Here's your toilet paper you'll use to wipe when you're done. Here are hand wipes that you will use to wipe your hands when you're done. And here is your call light. Let me know when you'd like for me to come back and take you off the pan. You'll step back from the bed, and then the evaluator will say that they're ready. Go ahead and get a fresh set of gloves. Put them on. You can go ahead and take the call light and the paper products from the client. Go ahead and lower the head of the bed. Okay, and if I could get you to lift your hips, again, don't overexpose your resident. All right, and we're going to head to the bathroom. When we get to the restroom, even though there is no fluid in the bedpan, you must simulate pouring the contents into the bedpan. Then you need to rinse the bedpan and pour the contents into the toilet. You, however, do not dry the bedpan. Return to the room and place this in the designated dirty area. Again, keep in mind, every time you return from the bathroom, you need to close the door for privacy. I'll place the bedpan in the designated dirty area. I now will remove the second pair of gloves, grasp the palm of one hand, pull it away, wad it up, go under this one, turn it inside out, step to the trash can, place it in the trash can. Again, always indicate that you would wash your hands right after glove removal, and return to the bedside to give the client their call light. The automatic failure for this skill is not ensuring that the bedpan is in the correct position. If you have it turned around, you will fail. That completes use of a bedpan. Good afternoon, Mr. Collin. I'm Karen, your CNA for the day, and I'm coming in to go ahead and get your dentures cleaned. I'm going to go ahead and get my gloves. The gloves will be mounted on the wall in size order. Go ahead and place your gloves on. Once your gloves are in place, you will take a paper towel and line the sink. Then turn both cold and hot water on so that you have moderate temperature slightly filling the sink. Your supplies will be here on the back of the commode. You can go ahead and open your denture cup and rinse all surfaces of your dentures. Do not lay them back down. Take your toothbrush and apply toothpaste to the toothbrush, returning the toothbrush to the emesis basin. She will then watch you brush all surfaces of the dentures. You want to ensure that you brush the tooth enamel, the gums beneath the teeth, the inside of the dentures, and also the bottom where they adhere in the mouth. Once you have rinsed all surfaces, rinse your dentures thoroughly, rinse your toothbrush and return it to the emesis basin. You then will take your cup, empty the water. You need to rinse the cup. You also need to rinse the lid. Then place a moderate amount of water back in the cup, returning the dentures to the cup and closing the lid. At that time, you may turn the water off, remove your sink liner, step to the blue trash can to throw it away. She will then watch you remove your gloves in the standard fashion. Grab the palm of one hand, pull it away, wad it up, go under this glove, turn it on inside out, again step to the trash can and throw it away, and indicate to the evaluator that you would wash your hands. This particular skill does not have an automatic failure. However, if you forget to line the sink, 3 steps include lining as part of the process, and you could fail the skill if that one step is missed. This completes denture care. Good afternoon, Mr. Collin. I'm Karen. I'm your CNA for the day, and I'm here to go ahead and get your vital signs. Before we get started, I'm going to close the door for your privacy, and I'm going to get my hands washed. You may bring a watch of your own, or you may use one that will be provided in the lab. Position yourself on one side of the resident. The evaluator will position herself on the other side. It's fine to get down in whatever position is comfortable for you. Locate the radial pulse on the thumb side of the resident. Once you've located it, it is necessary for you to tell the evaluator when you're starting and when you're stopping, so you all can be counting at the same time. For the purpose of the video, I will not count for 1 full minute. However, it is required that you count for 1 full minute during this skill. I also suggest you make the start when the second hand is facing straight up. I'm ready to begin. Go. Stop. Mr. Collin, here's your call light if you need anything. I'm going to get my hands washed, and then the last step will be to record on the paper provided. The automatic failure for this skill is being off by more than 4 beats, plus or minus of the evaluator's pulse reading. If for some reason you're having a difficult time palpating the pulse of the partner you were given, you can ask to switch sides. If you are still having a difficult time palpating the pulse, ask the evaluator if they can send in an additional client. That completes recording radial pulse. Good afternoon, Mr. Collin. I'm Karen. I'm your CNA for the day, and I'm here to get your vital signs. Let me close the door for your privacy and get my hands washed. On the day of the exam, you may use your own watch, or you may use the one that's been provided for in the lab. You will get on one side of the resident. The evaluator will get on the other side. You will count respirations for 1 full minute. You may either watch the rise and fall of the chest, or you may place the hand on the chest and feel for the chest movement. For the purpose of this video, I will not count for an entire minute. However, it is required that you do 1 full minute. Again, I suggest that you always start when the second hand is straight up at the 12 to avoid confusion. Tell the evaluator when you're ready to begin, and begin. Stop. All right, I want to go ahead and give you your call light. wash my hands, and then record on the document that's been provided for respirations. The automatic failure for respirations is being off by more than 2 plus or minus of the evaluator's reading. If at any time you feel you have lost count or you are uncertain about the answer that you got, it is suggested that you ask to recount for an additional minute. All you've lost is time, and it could ensure accuracy. That completes, counts, and records respirations. Good afternoon, Mr. Collum. I'm Karen. I'm your CNA, and I'm going to go ahead and put on my personal protective equipment at this time. The gowns will be located in this drawer on the day of the exam. Pick up the gown and unfold the gown so that the opening is facing towards you. Use caution not to let the gown touch the ground. Place your arm in the gown. Then you will take the tie at the neck and you will tie behind your neck. Try to make a loose tie so that it's easy to untie when the time comes. Then you need to attempt to cover the back part of your clothing. So reach around, try to get that to overlap. Take the strings from the front to the back and then tie that as well. Once you have your gown tied at both the neck and the waist, you then will select a pair of gloves that will be located on this table the day of the exam. The evaluator will watch you put your gloves on, ensuring that the cuff of the glove goes over the cuff of the gown. This needs to be present with both skills. Once you are satisfied with the application of your gown and of your gloves, and you feel like all steps have been taken care of, Marty will instruct you that it's fine to go ahead and remove the gown. You'll grasp the palm of one hand, remove the glove, wad it up, go under this glove, turn it inside out, and you will step to the trash can to dispose of your gloves. You then will reach behind and untie the waist, go to the neck, and untie the neck. Without touching any of the outer aspect of the gown, I want you to reach in and grab a portion of the inside of the gown and go ahead and take your arm out of one side. While still holding it, grab the inside of the other shoulder area, and once you have that hand out, turn the gown so that none of the exterior part of the gown is touching your hands. Again, be careful not to let it touch on the ground. You then will again be allowed to step to the trash can to dispose of the gown, and then you will indicate to Marty that you would wash your hands. The automatic failure for this skill is not ensuring that the gloves are removed before the gown is removed and using the proper technique to remove them. That completes donning personal protective equipment.
Cool.
Hi, good afternoon, Mr. Collum. I'm Karen, your CNA. We're going to go ahead and get you dressed. Before we get started, I'm going to close the door for privacy and I'm going to get my hands washed. We have 2 shirts that we can look at today. Do you have a preference as to what shirt you would like to wear?
No.
Okay, would this be acceptable?
Yes.
Okay, I'm going to go ahead and place this on the bedside table. Return this one to the rack. The evaluator will instruct the candidate that their right arm has had a stroke and they are unable to move it independently. What I'd like for you to do first for me is go ahead and just sit straight up in the bed. And if you'll take a hold of this sheet, I'm going to go ahead and undress this arm. Okay, actually go ahead and take your hand out for a second. Okay, now you can take that sheet. And then I'm going to undress this arm. Again, don't move your arm. Let me do all of the movement. Okay, all right, now I'm going to need to take the dirty gown out. So if you would just hold that gown to cover you. As I take the gown out, turn it away from you. And go ahead and drop it into the hamper. I then am ready to put on the new shirt. I will dress the affected side first. Use gentle motion of the arm and don't let go as it will drop. And lay that back down there. Okay. Now I'll hold this and go ahead and put your arm through the gown. Okay. I'm going to go ahead and begin to snap this. The evaluator will usually let you stop snapping after 2 or 3. Okay, there we go. You can go ahead and lay back now. Okay, here is your call light. If you need anything, let me know, and wash my hands. The automatic failure on this skill is not removing and putting clothes on in the appropriate manner. We always want to make sure that we undress the unaffected arm, and when we dress the defective arm. That completes dressing a client with an affected right arm. Hi, good afternoon, Mr. Collum. I'm Karen, your CNA. We're going to go ahead and get you fed. Before we get started, let me close the door for your privacy and get my hands washed. Could I get you to go ahead and sit on the side of the bed for me? While you're sitting up, I'm going to go ahead and get your meal tray. First thing I want to do is I want to ensure the correct client, so ask the client to state their name. What's your name, sir?
Corey Collum.
Okay, awesome. Let me go ahead and place the tray on the bedside table, and you want to position the meal tray in front of the resident so that it's easily visible to the resident. Then go ahead and get a chair, bring it to the area, and get wipes, which will be located on the bedside table the day of the exam. What I'd like to do first is go ahead and wipe your hands. So if you could give me your hands, go ahead and wipe those off. All right, good. Well, it looks like today, Mr. Collum, that we have a green M&M and a yellow M&M. What would you like to eat first?
Green one.
Okay. Here is your green M&M. You do want to make sure that they've swallowed the food before you offer the next bite. So you can ask questions such as, was that good? Have you swallowed that?
Yes.
Okay, would you now like the yellow M&M?
Yes.
Here is your yellow M&M. You must repeat what is on the spoon. The state requires that you offer 1 bite of each item and offer fluid 1 time. Would you like some water?
Yes.
Okay, let me help you with that. Okay, was that good?
Yes.
All right, once we've done 2 bites and 1 offer of fluid, let me go ahead and wipe your mouth off, and let me re-wipe your hands. All right, I'm now going to go ahead and put my hand wipes into the trash can, and I'm going to take the tray to the designated dirty area, which will be this chair on the day of the exam. I then will return to my client, ensure that they have the call light, there you go, and wash my hands. On feeding, the automatic failure is not ensuring that your client is at a 90-degree angle. The best way to accomplish that is have them sit up rather than just raising the head of the bed. That completes feeding a client. Hi, good afternoon, Mr. Collum. I'm Karen, I'm your CNA, and I'm here to go ahead and give you a bath. Before we get started, let me close the door for privacy and get my hands washed. I'm going to go ahead and get all my equipment. I will need a basin, soap, gloves, 3 washcloths, a gown, and a towel. I again suggest that you place all of your items on the Mayo stand to ensure that you have everything you need. Pause. Once you have everything on the table, go ahead and get your water. Make sure you have enough water that will adequately saturate a couple of your washcloths. Anytime you return to the lab, please ensure that the door is closed behind you. I'm going to go ahead and test the water. I'm going to ask my client to test the water. Can you go ahead and test the water and see how it feels? Okay. All right, again, I suggest that if you are right-handed, you work from the right side of the bed. All right, I'm going to go ahead and put my gloves on. First of all, what we're going to do is we're going to get your dirty gown off. So I can get you to go ahead and take your arm out of this part of the gown. I want to keep you covered up with this sheet. Take this arm out of your gown. Go ahead and bend your arm there for me. If you'll just hold that sheet for me, I'll go ahead and get this dirty gown out. Again, always fold the gown on itself and away from your clothing. You will then need to step to the hamper to throw the gown away at that time. Then take your towel, place it over the resident's chest, partially to give additional privacy, but also because you can use it to dry with. Take your first washcloth, wet it. Do not apply soap to the first washcloth because you'll be washing the eyes. Use the folded technique that we learned earlier with Perineal and Catheter Care. Hold it in the folded corner, take one flat back, and you're going to wipe the eye in to out. Then you'll need to change the position of the rag, wipe in to out, change the position of your rag, and wash the remaining portion of the face. Then the towel that is over the chest can be used to dry the face. You can now also use this towel to go under the arm. If you'll raise your right arm for me, and place the towel underneath there. My second washcloth, I will apply soap to. And then they will watch you wash the arm. Wash the hand, wash the arm, front and back, and the evaluator must see you wash the armpit area as well. And you can set that aside. Take your third washcloth, get it wet, and now we'll need to rinse all the surfaces that we washed. So we're going to rinse the hand, we're going to rinse the arm, both front and back, and then we're going to rinse the armpit area. Then you'll need to dry it, and you can use the towel that's underneath them. So I'm going to dry the hand, dry the forearm, both front and back, and I'm going to dry the armpit area. Okay. Now that they've had their bath, we're going to go ahead and put on the clean gown. So if I can get you to go ahead and put your arms back through this gown. There you go. And we can go ahead and bring this sheet down, cover you up that way. There you go. All right, you then can get rid of all of your linens into the linen hamper. You'll now go to the bathroom to empty, rinse, and dry your basin. Place all fluid in the toilet so that we don't have an error. Rinse my basin. Push the rinsed water into the toilet. Go ahead and take some paper towels, and as you're returning to the room, you can begin drying the basin as you walk back. Again, anytime you've left the room to return, you need to ensure that you close the door back for privacy. You'll then place the basin in the designated dirty area, which will be in this chair the day of the exam. Throw your paper towel away. Remove your gloves in the standard procedure. Grasp the palm of one hand, pull it away, wad that up. Underneath this, put it on top of each other. Throw this in the trash can. When gloves come off, we say wash our hands, and then go ahead and give your client their call light. Okay. That completes bed bath.
There you go, that's there.
Okay.
Good afternoon, Mr. Collum. I'm Karen, your CNA for the day, and I need to come in and measure your urine. Go ahead and get a pair of gloves that will be mounted on the wall in size order. Put the gloves on. There will be a fracture pan on the floor that already has urine in it. Pick up the bed pan and the container. Carefully transfer the urine from the bed pan into the container, and you can return the bed pan to the floor. Place your container on a flat surface. Get at eye level to ensure accuracy, and it would be a good idea to say the number out loud, as it will be a short period of time before you can record it. I see the amount to be 275 cc's. I then want to empty the contents of my container into the toilet. Rinse my container, empty that into the toilet. Rinse my bed pan, and empty that into the toilet. And once the equipment is rinsed, I may place it in the designated dirty area. The evaluator uses the floor as our designated dirty area for this skill. They then will watch you remove your gloves according to standard, grasp the palm of one hand, wad it up, go under this glove, turn it inside out, step to the trash can to get rid of your gloves. Indicate to the evaluator you would wash your hands. She will now follow you back to the classroom to record your amount. The amount was 275 cc's. On this particular skill, the automatic failure is if you are more than 25 cc's off from her measurement. The evaluator will have the accurate measurement. You may be 25 cc's plus or minus that. That completes measuring urine. Good afternoon, Mr. Collum. I'm Karen. I'm your CNA for the day, and I'm here to get you weighed. Before we get started, I'm going to close the door for your privacy, and I'm going to get my hands washed. Anytime you're getting a resident out of the bed, you do want to make sure that the bed is locked and in the lowest position. All right, let me go ahead and have you sit up on the side of the bed. I'll be glad to assist you. Go ahead and put your feet flat on the floor. And now if you go ahead and put your shoes on before we head to the scale. On each of the skills that are walking skills, your partner will be using their own shoes to take on and off. Okay, let's go ahead and walk to the scale. And when we get to the scale, I do want you to pause for a moment so that I can zero out. Zeroing out means returning both the top and the bottom to the 0 marker. Okay, go ahead and step up for me. I'm going to estimate about what I think he weighs, and I'm going to go to 120. That's not enough, so I'm going to go to 140, and that's too much. I now know that he weighs more than 120 and less than 140. So I'll go back to 120 and add weight in 1 pound increments. Until I get a balance. Because your partner is obviously breathing and incapable of being totally still, you may have a little bit of movement, but again, as long as you have ensured that it's hovering right at that point, it would be accurate. Go ahead and have your partner step back down. Let's go ahead and take you back to the bed and have you sit down. I'm going to go ahead and give you your call light. I suggest you return to the scale so you can look straight on and make sure that you have the right reading. I see 120 on the bottom, 5.5 on the top, so that is 125.5. Wash my hands, and then I will record as my last step, 125.5 pounds. The automatic failure on this scale is being off by more than 2 pounds plus or minus the evaluator's reading. The most common error that occurs in this skill is when the student slides this bottom weight into position, there are times that they don't ensure that the weight drops in to the groove. Make sure it drops in there or your reading will be off by more than 2. That completes weighing an ambulatory resident. Hi, good afternoon, Mr. Collum. I'm Karen, your CNA, and I'm here to do some exercises on your knee and ankle. Before we get started, I'm going to close the door for privacy and I'm going to get my hands washed. If you're right-handed, it's easiest to work from the client's right side. What you need to tell the client is if you experience any pain during this exercise, you need to let me know and I will stop. While supporting the ankle joint and the knee, you're going to bend the leg 3 times. 1, 2, 3. Again, make sure you return it all the way to the bed. Then you're going to support the ankle with one hand and take your hand and take the foot, and we're going to go do 3 movements of the foot. I'm going to do plantar flexion and dorsiflexion once, down and back twice, down and back 3 times. All right, let me go ahead and give you your call light. Need anything, let me know. And I'm going to wash my hands. The automatic failure on range of motion in knee and ankle is also not moving gently and slowly through the process and not stopping if the resident says they're experiencing pain. That completes range of motion of one knee or ankle. Hi, good afternoon, Mr. Collum. I'm Karen, your CNA, and I'm here to do some exercises on your shoulder. Before we get started, let me close the door for privacy and get my hands washed. If you are right-handed, it's best to work on the right side of the resident. Okay, before we get started, if you experience any pain during this exercise, you need to let me know so that we can stop. While supporting the wrist and the elbow in a cupped fashion, we're going to move the arm 3 times upward. 1, 2, 3. Okay, make sure you go to the level of the ear. Now we're going to go out 3 times. 1, 2, 3. Always return the body part back to the side of the resident. Go ahead and ensure that they have their call light, and then indicate that you would wash your hands. The automatic failure on range of motion of shoulder is not supporting the limb and moving gently and slowly through the process and not stopping if the client experiences pain. That completes range of motion of a shoulder. Hi, good afternoon, Mr. Collum. I'm Karen. I'm your CNA for the day. We need to go ahead and turn you on your side. Before we get started, let me close the door for your privacy and get my hands washed. I'm going to need 3 additional pillows, which will be on top of the cabinet the day of the exam. I suggest you go ahead and take them and move them to the bedside table. Then we will need to lower the head of the bed. The left lower button lowers the head of the bed. Then I'm going to raise the rail on the side at which I want my candidate to turn. Once the rail is up, I'm going to assist my candidate to turn. If you'll turn towards me, Mr. Collum. Once they're turned on their side, you want to adjust the head pillow in the correct position. You want to make sure that they did not lay on the arm on the left side. And then you're going to take one pillow, place it underneath the upper arm for support, a second pillow, and place it between the knee and ankle to provide support. And the last pillow goes behind the back. Go ahead and bend the pillow. Have your resident come slightly towards you. Stuff the pillow in place and then let them rest back on the pillow. If that happens during the exam, just have your resident come back forward, bend the pillow again, stuff it, and let them lay back on the pillow. All right. Here's your call light. If you need anything, let me know, and wash hands. There's no automatic failure for positioning on side in the bed. Hi, good afternoon, Mr. Collum. I'm Karen. I'm your CNA, and I'm here to provide some foot care. Before we get started, I'm going to close the door for privacy, and I'm going to get my hands washed. I'm going to go ahead and assemble my equipment. I will need a basin, soap, lotion, a pair of gloves, 3 washcloths, and a blue pad protector, which we will retrieve from the cabinet. I suggest you place all your items on the bedside table to ensure that you have everything you need before you get started. And while I'm going to get some water, if you could go ahead and sit on the side of the bed, I'll be right back. I'm going to go to the bathroom and get water. Again, get a sufficient amount of water so that it covers the foot when the foot is placed in the basin. Anytime you return to the room, make sure you close the door behind you. Since water's involved, I want to test the temperature of the water and see how it feels. I'm also going to ask the client to test that. Could you test the water for me? Okay?
Yes.
All right. Then I'm going to go ahead and get my equipment positioned comfortably for me. Go ahead and put my gloves on. I want to take the blue pad protector, place it on the floor, place my basin on the pad protector, and if I could go ahead and have you put your foot down in the basin for me. I'm going to take my first washcloth. wet it, apply soap. I then will lift the resident's foot out of the basin, and I must support it during the entire process. I want to go ahead and wash the foot, top and bottom surfaces, wash the ankle area, and then she must see you wash between each toe. Makes this easiest to have a pinch motion and just go through each toe, washing through that process. Okay? You can let the resident put their foot back in the water while you change rags. Your second washcloth is to rinse. You can wet it. Again, when your client has their foot out of the water, you must support it the entire time. Let me rinse all of the area that I washed, the ankle, the top surface, the bottom surface of the foot, and again, she must see you rinse between each toe. Again, this ensures just a gentle pinching motion to get down between each toe. Then you can place the foot on the pad. My last washcloth is to dry the foot. Again, support the foot. Dry all the surfaces that you've washed and rinsed. And again, you must dry between each toe. So take the same motion you've been using to dry between each toe. Once you've washed, rinsed, and dried the foot, you're going to apply lotion. I suggest using a very small amount, because what the evaluator will be watching for is seeing that you leave any excess lotion on the foot. So if you use a small amount, you're less likely to do that. If you do note that you've left lotion on the foot, you may take a cloth to wipe it off. The lotion goes on all aspects of the foot, but does not go between the toes. Once you're done with that, you can go ahead and take your linens, put them in the hamper. Let me go ahead and get this blue pad. Put it in the trash can. Head to the bathroom to empty, rinse, and dry your basin. Again, so there's no confusion, put all water into the toilet. Rinse your basin. Put your rinse water into the toilet. Go ahead and take some paper towels on your way back and begin the drying process as you're returning to the room. Anytime you return to the room after being in the restroom, please ensure that you close the door behind you for privacy. You will then place the basin in the designated dirty area, which will be located on this chair the day of the exam. Throw your paper towel in the trash. Remove your gloves in the standard fashion. Grasp the palm of one hand, pull it away, wad it up, go under, turn it inside out, and go ahead and step to the trash can to drop it. Anytime gloves come off, say wash your hands, and then go ahead and give the resident their call light. That completes washing one foot. Hi, good afternoon, Mr. Collin. I'm Karen. I'm your CNA for the day. We're going to go ahead and get your teeth brushed. Before we get started, I'm going to close the door for your privacy, and I'm going to get my hands washed. If I could get you to sit on the side of the bed while I get the equipment together, I will need a toothbrush, toothpaste, an emesis basin, a glass of water, a pair of gloves, and a clothing protector that you will retrieve out of the linen cabinet. Again, I suggest that you always place all of your equipment on the bedside table to ensure that you have everything you'll need. What I'm going to do initially is I'm going to go ahead and take this towel and place it over your clothing. Put my gloves on. Take your toothbrush. You may moisten it in the cup of water and then apply toothpaste. Please use a very small amount as a courtesy to your partner. Okay, if I could get you to open your mouth, I'm going to brush the molar surfaces. You can start on either side, get both bottom, then go to the top, get the molar surfaces on top on each side. Then ask your client to put their teeth together and get the surfaces of the teeth in the front. And then if you would please stick out your tongue, I need to brush your tongue. Okay. Don't set the toothbrush down. Let me go ahead and let you have some water. I'm going to let you rinse and spit. Okay. Do you need to rinse again?
No.
Okay. You want to go ahead at that time and wipe their mouth, and then you can go ahead and step to the hamper to place the towel. To make it easier with all your equipment, I'd go ahead and pour my water in here, and that way I can go ahead and trash my cup and wrapper immediately. Again, during this process, do not set down your toothbrush. We're going to go to the bathroom and empty, rinse, and dry the basin. I suggest all fluid go in the toilet. Rinse. Put the rinse water in the toilet. You will also need to rinse the toothbrush. You will go ahead and get paper towels, and you can begin drying the basin on your way back to the lab. Remember, anytime you return from the bathroom, you need to ensure that the door is closed. When the basin is dry, place the client's toothbrush back in the basin. Place it in the designated dirty area. Step to the trash can to remove your gloves after disposing of your paper towel. Grab the palm of one hand, pull it away, wad it up underneath this glove, turn it on top of each other, and trash it. Again, the automatic phrase should be, wash my hands. I then will return to the bedside and ensure that the client has their call line. The automatic failure on oral care is not ensuring that you brush all surfaces of the mouth, including the tongue. If you should forget the tongue, that is an automatic failure. That completes oral care. Good afternoon, Mr. Collum. I'm Karen. I'm your CNA, and we're here to do some catheter care. Before we get started, let me close the door for your privacy and get my hands washed. I'm going to go ahead and assemble the equipment that I'll need. I'll need a basin, soap, gloves, 3 washcloths, and a blue pad that I will retrieve from the linen cabinet. I suggest before you begin that you place all of these items on your bedside table to ensure that you have everything that you will need. You then will indicate that you're going to get water. Make sure you have enough water to allow you to wash and rinse. Anytime you return to the room, ensure that you close the door behind you. I want to initially check the water and see if the temperature feels appropriate. You will then have the mannequin feel the water. Just place the mannequin's hand in the water, and the evaluator will indicate that the temperature is appropriate. If you are right-handed, I do suggest that you work from the right side of the bed to make it easier. Once you're in position, go ahead and put your gloves on. Expose the work area, again, taking some consideration for not overexposing the area that you're going to be working on. Take the blue pad and place it under the work area. Take your first washcloth, wet it, apply soap. On this skill, you'll want to go ahead and fold your washcloth. Hold the washcloth in the folded corner and take one of the flaps back of the washcloth. You then will hold the catheter at the level of the meatus. That means holding it right at the opening of the urethra. And you will wipe down the tubing 4 or more inches. You then can let go to flip your rag, hold again the catheter right at the labia, and go down again at least 4 inches. Your second washcloth, you'll get it wet. Again, hold it in the same fashion. Hold this back. Catheter is held at the level of the meatus. Wipe down at least 4 inches. Flip your rag and rinse down 4 inches. The last washcloth will remain dry. Flip one area open. Hold the catheter and dry down at least 4 inches. Flip it and dry down at least 4 inches. You want to take caution to not tug on the catheter. When you're done, go ahead and remove your blue pad protector. Cover the mannequin up. Go ahead and dispose of your soiled linens. The washcloths can go in the linen hamper. The blue pad can go in the trash can. You'll then go to the bathroom to empty, rinse, and dry your basin. Again, I suggest that all fluid go in the toilet to avoid any confusion. Rinse your basin. Put the rinse water into the toilet. And as you're heading back to the room, go ahead and begin to dry your basin. Again, anytime you return to the room, ensure that you close the door behind you. Place your dried pan in the designated dirty area, which will be located on this chair the day of the exam. You may then dispose of your paper towels. Your evaluator will observe you removing your gloves in the standard fashion, the palm of one hand, pull it out, wad that up, go underneath this glove, turn it inside out, step to the trash can, and drop it. Again, remember, anytime the gloves come off, the immediate phrase should be, wash my hands. Then I'm going to go ahead and ensure that my mannequin has the call light. For catheter care, the automatic failure is not having the hold at the level of the meatus, not washing down a minimum of 4 inches, and not using a clean portion of the rag for each stroke. That completes catheter care. Hi, good afternoon, Mr. Collum. I'm Karen. I'm your CNA. We're going to do some perineal care. Before we get started, let me close the door for your privacy and get my hands washed. First, I want to assemble all of my equipment that I'll need. I'll need a basin, soap, a pair of gloves, 6 washcloths, and a blue pad which you will retrieve from the linen cabinet. I recommend that you always place your equipment on the Mayo stand to ensure that you have everything that you will need. I'm going to go get water. I'll be right back. Fill the basin to have an adequate amount of water, as you will be using 4 washcloths in the water. Return to the room. And make sure you close the door behind yourself every time you return to the bathroom. You want to make sure and you test the water first for comfort. You will need the mannequin to also test the water. So just place the mannequin's hand in the water. The evaluator will indicate to you that the water is appropriate temperature. If you are right-handed, I suggest you move your supplies to the resident's right side to get started. Go ahead and put on your gloves. Then bring the sheet back to expose the area that you're going to work on, but try not to overexpose. She must be able to see the work area, but use some discretion. Then place the blue pad underneath the buttocks of your work area. You'll take your first washcloth, wet it, and go ahead and apply soap. Now, in order to ensure that you do not use the same part of the washcloth for 2 strokes, you'll want to have your washcloth folded, holding the washcloth in the folded corner, and then take 1 flap over. You then will wipe front to back on one side, flip your rag, hold the flap, front to back on the other side, and then one more time, flip your rag, front to back in the center. This ensures you have not used a dirty portion of the rag for second or subsequent wipes. Take your second washcloth. Again, hold it in the same manner, pulling one flat back. I'm now going to rinse front to back on one side, flip my rag, rinse front to back on the other side, flip my rag, and rinse front to back down the center. The third washcloth will be to dry in the same manner. Front to back, one side, flip your wash rag, front to back on the other, flip your wash rag, front to back down the center. At that time, the evaluator will have you turn the mannequin onto their side in order for you to clean the posterior portion of the mannequin. The fourth washcloth, I'll put soap on. It is only necessary to wipe one time, but you must go front to back. So reach in, front to back with my wash rag. Take the fifth wash rag, and let's rinse front to back. And the sixth and final wash rag is to dry front to back. While your mannequin is on its side, go ahead and remove the blue pad and reposition the mannequin back supine, covering up the mannequin. At that time, you'll want to dispose of all of your dirty linen. The washcloths will go into the linen hamper, and the blue pad will go into the trash can. Then we're going to head to the bathroom to empty, rinse, and dry the basin. It's best to empty all water into the toilet. Rinse your basin. Empty it into the toilet. And go ahead and grab paper towels so that you're drying on your way back to the room. When you return to the room, ensure that you close the door back for privacy. Place the pan in the designated dirty area. The evaluator uses this chair as our designated dirty area. You will then throw your paper towel away. She will watch you removing your gloves again in the standard fashion. Grasp the palm of one hand, pull it away, wad it up, under, on this side, turn it inside out, and you may throw it in the trash can. Anytime the gloves are removed, the next statement out of your mouth should be, wash my hands. I then want to make sure that my client has their call light in reach. The automatic failure for this skill is not wiping front to back and not ensuring that you are using a different part of the washcloth for each stroke. That completes perineal care. Hi, good afternoon, Mr. Collum. I'm Karen. I'm going to be your CNA for today. We're here to get you in the wheelchair. Before we get started, I'm going to close the door for your privacy, and I'm going to get my hands washed. The wheelchair will be parked here on the day of the exam. Go ahead and position your wheelchair at the foot of the bed, facing the head of the bed, and you want to get it very close to the bed. Once you're in position, go ahead and make sure the bed is locked, and go ahead and lock your wheelchair at that time. Take the footrest and bring them up before you start. And once you're sure that your equipment is ready, you will need to assist your client to a sitting position. All right, Mr. Collin, let me assist you to sitting up. And as you sit up, if you'll scoot to the edge and make sure your feet are flat on the floor for me. And while I'm getting your belt, which will be located here on the day of the exam, can I please get you to put your shoes on? As the client is putting their shoes on, go ahead and get a rough idea of about the size you want for your belt. Then you go ahead and put the belt on. Just raise your arms there. Again, make sure the belt is secure and snug over the clothing. And again, I want just enough room for my fingers to go under the belt. While facing the client, we're going to give them instructions. On the count of 3, we're going to stand with upward grasp of the belt. We're going to stand on 3. 1, 2, 3, stand. Okay, now I'd like for you to turn and just back into the wheelchair until you feel your legs hit the seat, and then we're going to go straight back and ensure that your buttocks is on the back of the chair. I then want to go ahead and remove the transfer belt, put the footrest down, and go ahead and have your client put the feet on the footrest. Then I want to make sure that the client has their signal device and wash my hands. On this skill, the automatic failure is not locking the wheelchair and not assisting the client to a sitting position, ensuring their feet are flat on the floor. That completes transfer to a wheelchair with the gait belt.